King County, you're the chief of communicable diseases and epidemiology. Welcome.
Thank you so much. It's a real privilege to be here.
All right, good stuff. So before we jump into this conversation about COVID, maybe you can kind of briefly, because the title is really long, so I'm assuming the explanation might be long, but you can tell people, what do you do over at Public Health?
Oh, sure. Yeah, I know there's a lot of words in that title. So I guess in short, basically, I work with the team that oversees the notifiable conditions caused by infectious diseases in King County, including COVID-19. And I also happen to work with the Immunizations team, which helps with our vaccination strategy to help identify gaps, help increase vaccination rates for vaccine preventable diseases, again, like COVID-19.
Yeah, so all comes back to COVID, doesn't
it? Indeed.
all roads lead. Well, I mean, so speaking of that, right? And one of the things we witnessed here in like the last 3 weeks was what people like to say is sort of maybe a recovery in downtown Seattle. I mean, you had All-Star, and then right after that, you had Taylor Swift, and the Toronto Blue Jays came to town, which also packs out T-Mobile Park. You got people like, this was the first time in a long time really being downtown, of course, where our studios are here, that you were like, man, this kind of feels like it's back to normal. All that to say is where are we at right now with COVID-19?
Yeah, well, you know what? The number of people coming into the city to attend Taylor Swift concerts and other great activities is certainly a sign that things are evolving. We've certainly come a long way from where we were at the height of the COVID-19 pandemic. And so I think a couple of important takeaways. Now, since the beginning of 2023, a number of different measures that we use to assess the number of severe infections, like hospitalizations, deaths, have actually decreased since the start of the new year. And there's a number of indications that are particularly encouraging about where we are relative to where we were in the COVID-19 pandemic. But I want to make a couple important points here, because even though hospitalizations and deaths are decreasing, they're still occurring. And one of the things that I feel like we really don't talk about enough is long COVID, those long-term complications that affect people after infection. And long COVID doesn't really seem to care whether you're at high risk for severe disease. It can happen even after people who had asymptomatic or mild infection. So those are the things that we're really looking out for. So we try to tell people the things that we done during the pandemic to keep ourselves safe are still actually relevant right now.
Right. And what is the latest information now on the vaccine and on boosters? I'll be honest with you, as a member of the general public, for a while there, it just got very confusing. And it was like, here's a booster that does this, and here's this and that. Like, just real honest feedback is that everything was very on message. And then when these different variations of like, oh, and here's for this strain, you'll get this and this and that. I think a lot of the general public was like, man, bro, this is a lot. So where are we at now with the vaccine and with boosters?
Great. And I appreciate you bringing up this topic, because I think COVID-19 vaccines remains a really relevant topic right now. And I acknowledge that there is a lot of updates to recommendations, and that can be certainly really confusing. And so I want to highlight a couple points. One is that one of the greatest scientific feats that we were able to achieve during the pandemic was the development of highly effective and safe vaccinations that we were then able to distribute out into the community. And here in King County, I'm particularly proud because we centered equity in all our activities, working with a number of different organizations, trusted community partners, and leaders to help get vaccines to people, to address historic disparities and inequities to healthcare access. And we had this ambitious goal of achieving 70% completion rate of the primary vaccine series. And due to the hard work across a number of different leaders and organizations, we were able to not only achieve it, but exceed that. In fact, greater than 85% of residents in King County have completed their primary vaccine series. But we know that the virus has an incentive to evolve and try to evade our immune system, right? And so we have to pivot and update our vaccine to keep up with the virus. So as such, we've developed there's a new vaccine that's been available since last September, the updated bivalent vaccine that we've been encouraging people to get because it also targets the most recent circulating virus that's been in our community, and that is Omicron. So we lag. I think we've had a lot of success early on during the pandemic, but currently where we are with the updated bivalent booster is not where we would like to see. Only 34% of our community is up to date with recommended vaccines. And we're seeing disparities. Particularly in the Black community, we saw early on a lot of enthusiasm for the vaccine. Up to 80% of people had completed their primary vaccine series, but less than 20% currently are up to date with their bivalent vaccine that's been available. So those are the things that we're really concerned about.
Yeah, for sure. Like COVID is, man, it's on the move in the sense that like it kept like, oh, the word, this, you guys know how to stop this now? Now let me figure a way around it and everything else. So I guess vigilance is important in your business.
Absolutely.
Yeah.
You know, one of the things that we've learned so well about COVID is that it throws us curveballs. You know, people ask us frequently, what do you think is going to happen in a couple of weeks or next month? It's so hard to pinpoint, right? Because there are these new variants that come out, people's behaviors change, and that all influences what direction we head in with the COVID-19 pandemic.
Right. So let's talk about masks. Like, see, masks I think even more than the vaccine were created. It was so political around the mask. I mean, it was something simple, but it was very political in a sense. I mean, do people need to be wearing masks, or do they still need to wear a mask, or is this I mean, it's weird. Sometimes I'm on the airplane and somebody's wearing a mask and they're just minding their own business, and somebody's like, oh man, you're still wearing a mask, what's wrong? I mean, is it personal preference? I mean, I know there's no legal mandates anymore, but
Right.
I mean, as a medical professional, what's your stance on the mask?
Well, let me tell you what I do and what I tell my family and friends. You know, during the COVID-19 pandemic, we've acquired a lot of new knowledge about respiratory viruses, which COVID is one, right? And we also know we've actually developed these new tools and acknowledged these new tools that we can start to integrate into our regular activities that we know will protect against COVID-19, which continues to cause infections in our communities, and other respiratory viruses. So things like masks, I feel like still really have an important place in preventing infections in the first place. And I know a lot of people, especially during the summertime, are looking forward to travel again, being in public spaces, seeing other individuals that they haven't seen for a long time. And likely in their travels, they're going to be in these indoor public spaces, right? And so in those situations, I think that masks are really important because you don't have good air circulation, say on a plane or in an airport. A lot of people are coming and going. You don't know who's infected. And the last thing you want to do during a vacation is spend it sick. So I always bring with me a well-fitting, high-quality mask with me. And in those spaces that you just described, I'm probably one of those people that's sitting there trying to mind my own business and also wearing a mask. So
you're one of the people getting heckled?
So far, I haven't been heckled, but
so in the coming months, I know that you said that it's hard to predict around like the virus and directions that it go, but in a general sense, I mean, what can we be expecting, either about the virus, which is hard to track, or public health efforts?
yeah, so much has changed, right? Again, we're in a far different place now than we were at any other period during the pandemic. But we have these new tools that are really important for us to continue to integrate into our daily activities, as I mentioned. And one of the first steps that I would certainly advise to anyone who asks me my opinion about COVID is getting the updated and staying up to date with recommended vaccinations. Now, the one thing I think I can say for sure is that COVID continues to circulate and cause infections every day in our communities. What I'm most concerned about are those longer term complications that we know very little information about right now, but we know can affect people of all ages. Doesn't matter if you're healthy, you're an athlete. I've seen some people in our clinics that come in and were running marathons and suddenly not able to do anything because of their infection. And so I urge vigilance and not throw caution into the wind just yet.
Yeah, and speaking of vigilance, not throwing caution in the wind, a lot of people feel like COVID's over. Um, and like I said, being here in Seattle and in King County, I mean, that's kind of a legitimate feeling in a sense, because like I said, we're one of the as a big city in America, we suffered some of the lowest impact because of things the guys did to keep transmission low and vaccines and everything else. So it's kind of easy to have that sense of like, man, COVID, it's over. Let's move on. And people want to move on, like in so many different ways, right? We want to recover. And I really don't think that somebody who feels like COVID is over, I'm not saying you villainize them or things like that, but they shouldn't, I don't think people should be looked at like in a bad way, because it's like for some people, even if it wasn't a health tragedy, it might have been like a financial tragedy. I know so many Black business owners who lost their business, they never recovered. They want COVID to be over. I know so many people who lost family members, you know what I'm saying, and weren't there to be able to at least say goodbye. They want COVID to be over. Even just the vibrancy of our city and things that were there, they want COVID to be over. And so when people are like, man, is COVID over yet? Or are we moving over to COVID? I just preface that because that's something that you're up against when you're saying like, well, we need to be diligent, that you have to also like government, because even though you're in public health, you're government wants the public to be like, okay, this is what's going on. We want you to understand and trust and everything else. But government also has to understand where the public is coming from and their concerns about things. So say all that to say this. What do you have to say to someone who's like, man, is COVID over?
Yeah, that's really certainly a tough situation, and some things that we're continuing to work on in terms of messaging and trying to highlight, the importance of COVID-related precautions, while also acknowledging just the other impacts that are outside the science, outside the health issues that have also affected people, and people just want to move on. And, part of our goal of the messaging is really to highlight that, COVID-19 continues to be a risk. It's continuing to circulate in our communities, but I also acknowledge that people need to move on and get on with their lives, right? But the fortunate thing is that throughout the pandemic, we have these tools that we know that we can now integrate. You were talking about washing your hands earlier, right? Talk about these small things, small steps that we were doing during the pandemic that can now be integrated into our daily activities, that can continue to protect us while allowing us to engage in those activities that we once enjoyed. So, the reality is COVID is still circulating. There's still a risk. And we can do activities that we once enjoyed still safely by taking those elements that we learned. If you told someone, for example, washing your hands, right? Washing your hands, once upon a time, most people didn't understand the value of that. But now people do that more often than they were previously, similar to masks and the importance of vaccines. These are things we want to carry over and integrating into what we do.
Mm-hmm. I know for me, one of the things that if there was a carryover from COVID, outside of takeaway drinks from the restaurant, listen, let me tell you, if we want to put a silver lining on COVID, the fact that you could take your drink, it felt like New Orleans, other places was open. You go in to get you a drink and be on your way walking down the street. But one carryover that I'd like to see is the sense of caring and the sense of humanity that, not only here in our city, but across our country and around the world, that people had an emphasis on, let me look out for somebody else. Let me take care of somebody else. It forced people to think about populations that aren't often thought about. Man, how is this group of people going to get food? How are we going to do this thing? And we saw a city, we saw government, we saw organizations step up, whether it was like, man, we need to make transportation free, or here's food vouchers, make sure people get food, or here's how we can we can just care about each other. And, as we go through these transition phases, when we talk about things carrying over, man, I hope that the humanity was on display at its highest level at times during the pandemic. And I hope that that's something that can carry over,
Yeah, and thanks for highlighting that. That's such a critical piece that the work during the pandemic, the work that we did as a public health department, working and engaging with community partners, people who are so enthusiastic about these new vaccines that were coming out, that were going to help the communities, help turn the tide on what was happening. And that momentum, I really hope that we can carry over, not just for COVID-19, but to all diseases, right? And those are elements that are really critical and really are reliant on proper funding from the federal governments to ensure that we at local health jurisdictions continue to partner with community members and are addressing the issues that they're facing every day. And so, again, this is something that, yes, important for COVID, but applies to all of public health.
All right. Dr. Eric Chow, thank you so much for joining us, and make sure and pass my regards to everybody over there at Public Health.
Absolutely. Thank you so much for having me.
All right. We're going to take